Ever wonder how babies breathe in the womb? Oxygen travels from the mother down the umbilical cord and into the major arteries. Since the lungs aren't being used yet, a vessel called the ductus arteriosus diverts the oxygen away from the lungs and into the body. After birth, this all changes. When babies begin to breathe on their own, the ductus is no longer needed and naturally closes. This allows oxygen to flow down its intended path. But what happens if the ductus fails to close? It becomes what Dr. Frank Ng calls a patent ductus arteriosus.
Blood that has oxygen that's supposed to go to the body goes back to the lungs and you can't get any more oxygen. So number one, your body is working harder to pump that blood in a circle, but number two, you're flooding the lungs so you can't breathe very well.
In the past, the only way to close a patent ductus arteriosus was through surgery.
You cut the chest, you open the chest, move the lungs away, identify that PDA, and basically tie it off.
Several years ago, doctors realized they could avoid surgery by tunneling a catheter through a blood vessel, finding the PDA, and plugging it up from the inside. While the devices have gotten smaller over the years, premature infants have still been too little to handle the size of the catheter, until recently.
So you can see the white catheter is the first generation. If you see the second one, it's even smaller with a finer delivery cable. But the last one, you can see that that wire is as thick as a hair. Here at UC Davis Children's Hospital, we've been able to collaborate with our neonatologists to start this program where we're closing PDAs in premature infants. And we're talking about patients that are as small as even a kilogram and even smaller than that. I would say the smallest probably can be done is about 700 grams. That's a little over a pound.
By not having to undergo surgery, the recovery time for premature infants with PDA is much faster and the results are almost immediate.
You see on x-ray before the closure, the lungs look really flooded, but as soon as you put it in, then by the next day or even that evening, if you repeat the x-ray, the lungs actually are starting to clear already. So you can see an immediate improvement.
This means that these premature babies can start spending less energy on breathing and more energy on growing strong and healthy.
This digital short is supported by UC Davis Health, home to the #1 ranked medical center in Sacramento by U.S. News and World Report. Learn more about their doctors and passion for advancing health at health.ucdavis.edu.